Hi, I'm Dr. Edwin Williams. I'm a facial rejuvenation specialist. I do a lot of facelift surgery. I also do a lot of blepharoplasty in the facial rejuvenation process. One of the questions I'm asked is what exactly is a blepharoplasty? And that's the purpose of this fireside chat, to just say, to explain to you what is a blepharoplasty. Bleph means eyes, and oplasty, plasty means to change the shape or form. So basically, to do surgery on the eyelids, to change the shape or form, is really the main definition of a blepharoplasty. When is it performed? It's typically performed on the upper eyes when there's a lot of excess skin or maybe some puffiness there that makes the aperture of the eye smaller and look more tired. Or it can also be performed on the lower eyes when someone has maybe bags on their eyes or a drawn out look making them look a lot more tired. So that's when it's performed. The procedure on the upper eyelids takes about a half hour, and it's primarily skin. When we do the lower eyelid, we take out the fatty tissue here, the bags, and oftentimes patients have lost some volume in here, so we customize that and do what we call fat grafting. And sometimes people need a little bit of skin removed as well to make them look a lot more refreshed. Now, we have a lot of before and after photos on our website, but the bottom line is this. What we really try to do is we try to customize the procedure to the individual. If you think about it, it makes perfect sense. Not everyone's lower eyelid is the same. So if you were to come in for consultation, I would tell you the exact approach that we would use with your particular anatomy. What's the recovery? Again, the surgery, the lower lids take me about an hour, the upper takes about an hour and a half. It's done with twilight anesthesia, and the patients go home that same day. Most patients describe it as feeling like a little bit of a paper cut, so it's not really a painful procedure. Most people take Tylenol. And the next day, most people, they look a little bruised for 2 to 4 days. In fact, when we do fat grafting, sometimes people look more like 6, 7, 8 days, meaning that you're not ready for the family portrait on day 7 or 10, but usually people can go out in public comfortably around 7 to 10 days. What are the risks? What I tell patients is this. I like to talk to folks about limitations. And one of the things I tell them is that most people have a little asymmetry afterwards. And one of the other limitations is I can't get someone 20-year-old eyes. But if you look at our before and after photos, you can see these people have very, very reasonable results. As far as major complications, I've had one major complication in my career where we had a patient, of course it was about 15 years ago, and it was a physician. I had to take the patient to the hospital and they had some bleeding. Long term was not a problem, but the bottom line is if someone's having discomfort or pain after the surgery, we need to know about it. We did write a book. I wrote, this is for patients. It's Blepharoplasty, Everything You Need to Know About Revitalizing Your Eyes. It has every frequently asked question in here that you might want to ask. It's available as a PDF download on our website, so I'd encourage you to visit the website. And it's available on Amazon, and the proceeds of this do go to domestic violence. So I hope I answered your questions on what exactly is a blepharoplasty. Thanks for taking the time.